Good. Did you want to have a question about the lungs?
Yes.
They're actually better today. Her numbers are perfect today, but again, you see this number, what I said is like in the teens yesterday, it's like teens to 20s. So that just shows that they don't expand the way they're supposed to.
Mhm.
And so, I tried to put on ASD yesterday, which is a lower bid setting.
Mhm.
And that's what we put them on right before we try to do spontaneous. And you do spontaneous right before you try to put them on trach collar. And she couldn't tolerate the ASD. So, like I was saying yesterday, once you get fibrosis, that's it. Inflammation, you can reverse. Fibrosis, you cannot reverse. And so I think the pulmonologist said the same thing, that we feel like she's going to be vent dependent. Or she's not going to get off the ventilator. She's going to need the ventilator.
So there's nothing else. No lung transplant.
She's not eligible for one. So no. But that would be like say if that was all her problem, like say if it was like one of us to walkie talkie off the street and we just have fibrotic lungs, then yes, we would be able to get a lung transplant. But with her having an active infection, renal failure, all those other things, she's not a candidate for a lung transplant. I think the pulmonologist already talked to you guys about that before too.
Mm.
I ain't heard nothing.
Well, they were talking yesterday, and I told them I wanted to talk to her today.
I don't know who's on this.
Okay.
So what is her prognosis then?
Oh, I mean, she'll be fine. She's just gonna be on the bed.
Like, everyday life, she's
She's
gonna
gonna be on the ventilator.
like this machine or
I think they have the kind that you can take. I don't know what the ones are that they use at home, but there are people who have a home ventilator. People who but she'll be on a ventilator. She's not gonna not be on a ventilator. Her lungs are fibrotic now. They're fibrosis.
but
And unfortunately, once you get fibrotic lungs, you will be on a ventilator.
she won't be able to do everything that she was.
She won't be able to talk is one of the biggest things because you have to have the balloon is up, and you can't take the balloon down unless you're off the ventilator. So, and let's try it again today because I know when she was in CEICU and I switched her to ASD, her compliance actually was better on ASD than it was on the ventilator. But yesterday when I did it, it was not. So let's try it. You can always try. So this is the number I'm looking at. And this number.
13.2.
And this number. So you see how this number went down? This number went down.
Try to take
For her, she's tiny, so it's probably still okay. But see, when these numbers are coming down, they're much lower than they were. And the problem is, when those numbers are down, that means that she's going to have more carbon dioxide in her system.
Mm-hmm.
So that carbon dioxide number will get worse. I think today it's close to normal or normal.
pretty good. 731, 48, 39.
Yeah, so it's still
which
high,
is good
but
for
not
her.
horrible. Yeah, exactly. High, but not horrible. So now she's coming back up because she's doing. Take some deep breaths. Don't let the machine do all the work. You do it. So 79, 89. So this is better. Get up higher. Keep going. Breathe deep.
There you go. Yeah.
Breathe deep. Keep breathing deep. Good. Because when you breathe deep, this number gets better. Keep going. Deep breaths in and out. See how that's 19. So this is what we're looking at because this number needs to stay there.
12.
Yeah, for her about 12. And see, this number's 100%, which means that she's doing most of the work. So that's good. So and you see how this came up? See, this is what happened last time. Her compliance actually got better on ASD when I put on ASD and when she was on the 9th floor. Because I remember looking at her like, oh, she's actually better on ASD. And that's when I was thinking that we could probably do spontaneous and all that for her.
Mm-hmm.
So let's keep her on this for about an hour. Let's see how she does. And we'll check a BBG again and see how much acid she's holding on to.
So there's nothing definite.
There's nothing definite. That's better. And like I said, that's what she was doing when she was on the 9th floor too. She was tolerating ASV. I think I kept her on ASV for like a whole day.
Yeah, I think so.
So let's see how she does. That's all we can do. And like I was saying, her numbers this morning were really good. So let's see how she does. She's gonna have to breathe faster because she's kind of has to breathe that CO2 off. But But if she ever gets to a point where she can tolerate ASD and then she can tolerate spontaneous, then she would be able to do like an air balloon off the bed.
Mm-hmm.
Yesterday when we tried,
It was.
yeah, it wasn't good. But today it's good. We'll see what happens. That's all we can do. I mean, I'm hoping
The other stuff with the dialysis, how that's.
she's gonna be on dialysis. That I don't anticipate getting any better. I think she will be on dialysis, but you know, dialysis is like 3 times a week. A lot of people on dialysis.
But I remember Dr. Good was saying that, I mean, they could come back. Her kidney, I mean, it might
It's
take
always
a couple of years.
possibility, exactly.
Yeah.
That's always a possibility. Generally speaking, when you're on dialysis, those days in between the dialysis is when you'll start peeing. So we'll, you know, that's how you gauge it. And then usually if somebody looks like they're having renal recovery, then we give them something like Lasix and see if it gets better, see if they get able to pee off. And then sometimes what it is that they're okay, they're peeing, but they're not clearing their blood, they're not cleaning the blood. So they're not filtering things out. So you need dialysis for that.
There's no one, and she is on her blood pressure, everything's low.
This for her is fine. Yeah, that for her is perfectly fine.
But when she's not on the machine, it's better than that.
Which makes sense. If I pulled off 4 liters from you right now, your blood pressure will go low as well.
Oh, I'm sure.
So, this
I'll
is
probably,
for her.
I'll probably drop 5
Yeah.
down at the restroom.
This
I
for
got
her
it.
is fine. This is perfectly fine. So let's see, let's do it for an hour. Let's check another BBG and we'll try, see what she does. But again, she does have fibrotic lungs. I'm not optimistic, but we'll try. No, we can do it. Okay?
Yeah, okay.
Let us know if you get tired, okay?
Yeah,
Mr.
let's
Trigger,
hope we
okay?
get
Oh,
tired.
and the TPN, they changed it?
It looks like they took the fat out, from what I can tell, so maybe
Uh-huh.
the cholesterol was going
Well,
up, 'cause it looks like the
and then
fat
I
was
guess they started the feedings too then?
only at 5 cc's an hour.
Well, I thought it was 10.
Yeah, it's just at 5.
Yeah, it started that last.
Yeah.
Yeah.
She was on 10. Dr. Gupal wanted to decrease it to 5.